Hey, Constance, how you doing?
Doing great. How are you doing, Sarah?
I'm doing well.
I was going to say, I missed my cue.
We are in the middle of summer now. We've got a lot of things going on, and we have a really exciting guest today. We have Ferris Taylor, who's speaking to us really about how people rose to the occasion throughout the pandemic when it came to taking control of their health.
I love to hear from Ferris. He has been at this a long time. As you know, he put a health plan out there in the ACA days and really wanted the health plan to be designed around the consumer, which was kind of new and innovative at the time. And so he has really followed where we are as payers and health plans, making it convenient and available for consumers to actually act like consumers in the health industry.
Well, let's get to it.
Awesome. Let's go.
Hey, Ferris, I'm so glad you could join us today. How are you doing?
I'm doing great. How about you?
I'm doing well. It's a little rainy here, but par for the course. Things are opening up as they have been for the past several months, which has been really, really exciting. How about you, Constance?
Yeah, we've had a hot summer here so far in Minnesota. I'm actually up in northern Minnesota where it's much cooler. So yeah, I'm doing well.
Yeah.
And Sarah, the West will take all your rain, all the
I
rain that you can
know.
stand. We are burning up.
Oh
I
my goodness.
know.
It seems like every day there's a fire somewhere else in the mountains in
Oh
Utah. Some of them they
God.
can't even fight because they're so remote, but we're burning up. So send your rain west.
I will send it over you. Absolutely.
That's a
Absolutely.
promise.
So, Ferris, there are so many things we've learned during COVID, and I know you've been kind of documenting some of these. I was hoping we could take some time today just to talk about, a handful of them, the top 3 or 4 learnings that you think both consumers and even the health industry has had based on COVID.
Wow, that's a big topic. 2 or 3. I'll stick to that.
Okay.
And
So,
you know, I think
Number one.
Sarah and Constance, I think that we may look back 5 years from now or 10 years from now at the pandemic and realize that it was a watershed moment for healthcare. In my 30 years in healthcare, not much changed. And then suddenly in the last 18 months, it seems like we've seen more innovation and more change in healthcare than we've seen in the last decade or even 2 decades. And in my mind, it is all good. I had one of my HCEG board members say to me a year and a half ago, "Hey, Ferris, don't waste a good crisis." And I think we've had a good crisis for healthcare. But I think in sort of taking your question, Sarah, I think the heart of that in my mind is how it's changed at the front line, how it's changed really at the consumer level. In many ways, I think we have a national population, a worldwide population that thinks very differently about health and health care than they thought about it 18 months ago.
Right.
And that's really important. We've talked about consumer engagements. Constant, you and I have been back and forth for a decade on how you engage consumers. But all of a sudden, everybody was engaged in healthcare. My perspective on that is up until the pandemic, mentally, the consumer was disengaged from their healthcare. Their employer or the government paid most of the
Right.
costs, the premiums. They didn't even know what it cost. And their attitude, and this is a Ferrisism, not a research-based thing, but I think their attitude was, I can do anything I want to do. I can eat what I want to eat. I don't have to work out. I can be a couch potato. When I get sick, it's the doctor's job to make me better.
Mm-hmm.
COVID hit, and the doctors couldn't make the population better. It was a once in a century virus. We had history from 1918 and Spanish flu, but suddenly consumers were very engaged. And, I'll set aside all the controversy and the politics and everything that got embedded in that. But consumers realized I have to do something to keep myself well.
I kind of think of health switched, like other industries, from health as a building to health as a service. So in every other industry, they have gone from you need to walk into a building to get something done, whether it's a bank or a grocery store or, purchasing a service, even like travel. But now it is as a service. So I expect that it's going to be available somehow remotely, whether it's phone, computer, location in my neighborhood that's not a health facility, but a health-ish facility, health consumer facility. So, I see that shift to consumerism has been supported by the industry showing up with as a service solutions to meet their needs.
And Constance, that's the other part of the change that took place. I've been involved in telehealth since 2002. Roche Diagnostics started an initiative called mydoc.com, and it was computer-based, and consumers loved it. And I remember coming out of O'Hare, and there was a billboard saying mydoc.com, and you could get consults. And the state medical society filed an injunction. It was infringing on the building that you're talking about.
Mm-hmm.
And of course, Roche Diagnostics didn't want the bad publicity, so they closed it down.
Well, and how do you code for it? How do you bill for it? How do you pay for it? Where is it the plan design? None of that was established.
None of that was in place.
Yeah.
Again, when the pandemic hit, it wasn't just the consumer that didn't want to go to the building that you're mentioning, but it was the doctors in the building that no longer had patients.
Capacity. Yeah. Or they couldn't let you in the building, right? Mask, no mask, like, no, you're not allowed unless.
And I think there was even an additional layer, like you were saying, Ferris, all of a sudden we became accountable for our own health. Like, okay, so there is this thing of digital healthcare, but also I should probably just stay healthy. So we kind of took a few steps back and did a little bit more well care.
And it may be interesting. We'll look back on the data at some point, but there's been a lot of discussion about delayed care and non-emergency surgeries and like that. And we're sitting here in June of 2021 and saying, well, the second or the third quarter, we're going to see that uptake come back. And yet we may not. We may have found that people may be the system, the process that we had established had people consuming more care than was really necessary.
And maybe it was sort of proactive, reactive care, right? It wasn't, I have clearly identified symptoms and obviously I need a physician to intercede. Or, it was not at that level for many people. It's like, I kind of feel like, and maybe a physician should look at, and since my employer is covering it, why not?
Right.
But now it's like, unless I absolutely have to go in at risk in a COVID environment, I'll figure it out myself. Like, I'll get over the counter, I'll go for a walk, I'll see how my symptoms trend. Of course, for acute, that's not an option, right? Or episodic, but for the most part, how often have we gone to the doctor and they've said, well, let's see how it is in 2 weeks.
Right.
Time, right? Give me a call if. Unnecessary visits, and that's a harsh statement because of course, if things are serious, you need to go in, but consumers have started to educate themselves about when do I really need an appointment and when are the remote services or virtual services available that can step in.
Well, and I think embedded in that is that, and we saw, I've seen numbers, 2,000-3,000% increase in virtual consults of some type. But on the consumer side, I think there was also a change in terms of, do I need to go to the building or to the doctor's office to have my blood pressure checked? Or in this digital world now that I have, for $40, $60, I get a blood pressure cuff, and it records and sends my data to the doctor, and I no longer have to go to the building, as you said. And I think that it really, part of this transition is that we may have moved out of the industrial age into the digital age. And the industrial age, when you step way back from it, it was all Adam Smith, efficiency, division of labor, getting everything to run efficiently. In the digital world, it's a very different environment where the data and the data liquidity is flowing. And as you said, Sarah, it isn't just virtual. Now, the care is coming to me in the home.
Right.
It's back to the future. Doctors' visits to the house are, house calls are back in vogue. I have my health plan calling me and saying, we want to come to your home. And of course, they're going to see a very different picture when they come to my home than they see of me when I go to their building.
Mm-hmm.
They get a snapshot as opposed to a total view.
Mm-hmm.
And that's all part of this watershed moment. Everybody's thinking differently.
Yeah. And
well,
I keep hearing, go ahead, Constance.
I was going to say, it would be interesting as well, while that was happening, while coronavirus was keeping us out of the building, we also had a new awareness of the social determinants of health, partly because that acronym was out there, right? We were starting to look at the zip codes of care. But the other part is that people lost their jobs. People were displaced from their homes. People couldn't pay rent. So there were now real mental and physical health coming together in what is termed the SDOH. And I think partly other organizations stepped up, right? When the health industry wasn't able to step up because they were in crisis mode, other organizations tied to the social determinants of health started to show up. So it'll be interesting as well to see how much of that sticks, how much of the health plus becomes more of the ecosystem of the healthcare industry than just the healthcare industry that has sort of, come up through the ranks of training and application of health services.
Well, and I think,
go ahead, Sarah.
No, so I think everything we're saying it's like this awakening where we were very passive about our health. To your point, Ferris, right? I can do whatever I want. I'm going to go to the doctor. They're going to fix me. To become very proactive about our health with the digital tools. I can do my blood pressure at home. I can monitor these things at home. And then in doing so, I educate myself. I become more aware of well care as opposed to sick care, and know when I need, whether it's virtual care or to go in. But we've taken a lot of that responsibility on, is what I'm hearing from you and from others, because we were thrust into this pandemic where we literally couldn't leave our house.
Well, we also couldn't afford to get sick, right? We didn't have
Right.
a safety net, whether it was our job or our coverage was at risk, or our environment that we were now living in and working in had no ability for one in the family to get sick, right? We're all going to get sick if any one of us gets sick because we are stuck together here for a year. So I think, people really started to have healthy habits, and by the fact that everybody now was using hand sanitizer when, nothing would have made that happen unless it was a pandemic, to get everybody to actually wash their hands after they go to the bathroom or eat foods or share a handshake.
And we didn't have a flu season.
We didn't.
Everybody wearing a mask, we didn't have one, but that does show the impact of the change of behavior. But I want to pick up as well on something you alluded to, Constance, and that is, I think the pandemic exposed the serious gaps in the healthcare system, including the disparities and the inequities that were just fundamentally built into our system. That spilled over due to the social unrest, and it spilled over in terms of the political process and the dysfunction that we had from a political point of view. How did we have a pandemic of this magnitude hit us with the entire system, the government, the private system, the public systems, totally unprepared? I went back. I spent my healthcare career in Boston, was relocated here to Utah with respect to running pay market strategy for Optum, but ended up with, with starting a consumer-oriented, a co-op health plan in the state of Utah. And I will say that experience was kind of similar to what I think some of the fundamentals of the COVID pandemic has brought out, because our co-op, consumer-oriented, consumer-operated, that's what it stands for. It's a co-op. And my thinking about healthcare totally changed with the requirement that our board of directors all be members of our health plan. And when your boss is your customer, you think very differently about disparities in healthcare. You think very differently about the technologies, the digital tools that can be used to make healthcare convenient for the consumer and for the community at large. I will say, you mentioned reimbursement. The pricing on telephone consults may have been totally misdeveloped because it was a fraction of, or a portion of, an in-person office visit, because in-person was better than a virtual consult.
Right.
When in fact, if you were Sarah with a couple of children and a spouse and a job and everything else, what would be the value of a virtual consult or a phone consult for 10 or 15 minutes scheduled in the middle of your life? It would be more valuable than getting one of the children off to dance or baseball and being sure that dinner's all ready and somebody's covering my job, what I have, in order to go and sit in the house or in the doctor's office for 45 minutes waiting for the physician's schedule. You would pay more for that, than you would pay for the in-office visit.
A couple of the areas that I feel like it got exposed, because of the defects of the current system or the inadequacies in services. One was we were working on the opioid crisis, and we were feeling like, at least, I don't know the stats, but feeling like we were making a little bit of headway. And then we were also kind of working on mental health. We had mental health parity. We were recognizing mental health. There's a dialogue in the public about mental health. And yet public health, mental health is one of the biggest, damages that have happened from COVID. There's now shortage of mental health services and providers and facilities. It's now down to the 6-year-olds that are dealing with mental health. So I feel like the COVID, while it increased this awareness of health and healthy living and resources, there's a whole group of people in that mental health bucket, that anxiety, emotional bucket, that have not been served during the COVID pandemic. And I don't know that they're going to fix it anytime soon. I don't know that the resources will show up to deal with that tied to the opioid drug epidemic that we already had in place.
And even there, have we fully explored? I mean, the data definitely before COVID pointed out the need for mental health parity, behavioral health parity. 40% of those with chronic conditions had a source of that problem being behavioral health or mental health concerns. But the question that I put on the table is, have we brought today's 21st century technology to bear on that challenge?
Yeah, and then there are some, I can't speak to the product, but there are texting options where you can, text with your therapist. But one thing with the WELL clients and the health plans that are utilizing our platform is they are starting to talk to us about highlighting these types of benefits that they offer. If they offer, any kind of digital services or telehealth services. So I think that the pandemic was a very fast moving because it had to be. And I think it's probably, unfortunately, it's not going to move quite as fast, but I think people are trying to ride on that wave and say, okay, well, we were able to do telehealth. let's now increase that and market that so that the consumers can see that if you appreciated this offering, we can continue to serve it. I'm seeing a little bit of that, at least on the well side.
And I that optimistic comment, Sarah, is so important. We're so caught up in the now the Delta variant and what's going to happen. We're not out of the woods yet. Are we out of the woods? We're trying to get out of the woods. But in fact, if we step back and take a look at the last 18 months, technology has also been the miracle. If you look at what happened with the development of the vaccine, that has to encourage everyone to some degree that the 21st century tools that we have, the data, the analytics, the technology platforms, the fact that, mRNA technology for developing a vaccine had been out there for some time. The crisis hits and we turn that on. We think differently about clinical trials. For the three of us that have been in healthcare for a long time, you can't do anything in healthcare unless you've had 250,000 people over multiple years going through tests to verify that it's not going to do any harm, no harm. And yet now we think a little bit differently about that. We have a vaccine, not 100% effective, but nothing is 100%. The effectiveness of and the efficiency of the technology that was developed has to give us optimism about applying that technology to behavioral and mental health, applying that technology to things that we've heard talked about. I wear an Apple Watch. What could that do? Could that measure my level of activity? Could it be an indicator if I got into the data of, hey, I'm feeling down today? Right. And what can be done to pick me back up? Or I'm seeing some irregularities in your heart or your blood pressure. Shirts now have biomonitors in them, mattress covers. The opportunities going forward, with a very different mental framework on the health plan side, on the provider side, on the consumer side, could take us from the 19th century into the 20th century and fully into the 21st century. There are lessons to be learned from how other industries have made the transition. And I think you talked about it, Constance, where it's amazing. I almost think about something that I might like to have and go online to search it, and then it pops up, and the next day it's on my doorstep. That's not healthcare today.
It's not, but go ahead.
No, Sarah, please.
Well, I was just going to say, it's not healthcare today, but we saw this huge explosion over the pandemic. And as horrible as the pandemic was and is in many cases, I think that it's maybe the catalyst that we need. And many of the people we've spoken to here and elsewhere are saying the same thing, that there was this huge catalyst, things were moving so much faster. So what do we do collectively to keep that level of speed and innovation up? And that's really what I'm looking forward to. That's what I'm really excited about. Hopefully, Ferris, you'll come back in a couple of months and we'll be able to look back and say, oh yeah, we kept going. We had some new great things. So I would absolutely love for you to join us again on a future podcast to talk about more learnings for COVID, or where we are now, or something new altogether. But it's always a pleasure to speak with you. Thank you so much for joining us today, and be well.
Thank you. And thanks, Constance and Sarah, for this conversation. There is much to do in the future, and let's take advantage of the opportunities. Thank you.
Thanks, Ferris.